No, okay? So thank you, Susan, and thanks to the organizers for having me come here. I'm delighted to make the trek. Heading south in the winter is always a good rule of thumb if you're from Minnesota. Going where it's warmer. Just one quick correction. Last spring I left IATP, where I'd been for 12 years, and now, so I'm just devoted to healthy food action. So let me explain a little bit about what that is, and you'll hear more about it tomorrow. But Healthy Food Action is a national network that we're building of health professionals to both educate and empower them to advocate around food policy, food and agriculture policy. And you're going to hear about a lot of environmental health issues at this conference. And in my work over the last decade or so, it's really been focused on food as a critical part of the environment. And so that's kind of the focus of my talk today. I'm going to call it a story in 3 parts. And I'm going to cover a lot of territory, but I hope we have time for questions at the end as well. And I'm spending a lot of time on one particular part of the food and environment, and that is antibiotics and antibiotic resistance, because I've spent it's not only a very important issue, but it's one I've spent a lot of time on. And it's the first of what I see as sort of a colliding series of crises. And so the crisis in this case, which have been noted both by Margaret Chan of WHO and more recently by Sally Davies, the Chief Medical Officer of Britain, the crisis is that our antibiotics are getting less effective, that we're kind of running out of these miracles, and we're facing a future, maybe in the next 10 to 20 years, if we're maybe quicker if we're not lucky, slower if we are lucky, but it's coming, where even common infections are basically untreatable. And we're already seeing the impacts of this. These are pictures of patients from the Infectious Disease Society of America website who've either died or been severely impacted by resistant infections. Most of these occur in hospital settings, but a substantial number are community acquired. You know, young people who are healthy, football players, and others. And the reason I put this up here is that though most of us know that this is a huge issue, it still somehow seems largely invisible to the public at large. And I think it's because we don't talk enough about these stories. So who's next? You know, any of us could be. With something like MRSA, it strikes down people who are healthy, not just immune-compromised folks. So I think we hit a major leap forward when the CDC released this report in September, antibiotic resistance threats in the United States. And there are a number of reasons why it's important. One is that it really tried to tally the human toll. More than 2 million infections a year, 23,000 deaths a year. The bulk of those are from MRSA, but increasingly from other things as well. Carbapenem-resistant infections, extended spectrum E. coli infections, et cetera. The main thing here is that, it's a lowball estimate. And the CDC was very upfront. They deliberately made it a lowball estimate. The numbers could be significantly higher. And these aren't just human costs. There's also like tangible economic costs to a healthcare system that's already strained. So, you know, we're talking about the cost of more infections than we'd otherwise have. The cost of harder to treat infections resulting in longer hospital stays, more complications, and then time off of work. So just the direct treatment costs alone for these resistant infections carries a price tag of about $20 billion extra a year in healthcare costs. If you factor in, all the other costs to society, like time off of work, it's more like $55 billion. And those are 2008 dollars. If you extrapolate those forward to 2014 dollars, it's more like 70 billion or more. Big numbers. So one of these other colliding crises, and I probably don't need to tell you about this, is this epidemic of diseases related to diet. Things related to the obesity epidemic, or as some call it, the diabesity epidemic, so diabetes, metabolic syndrome, as well as things like stroke, cancer, heart disease, and these are among the top causes of death in the U.S. Cumulatively, they carry a price tag of $190 billion a year just for obesity, but far higher if you factor in all the other causes for these related syndromes. There's another collision, and that is what has become this almost expected litany of foodborne outbreaks. You know, the latest being Foster Farms chicken, Salmonella Heidelberg, which is increasingly resistant. But any given year, you know, it could be E. coli 0157H7. It could be any of a number of strains of Salmonella. Just many different things. And increasingly resistant E. coli, too, that are acquiring, as we're going to hear about, these resistance determinants that make them harder to treat. And then there's the simultaneous problem of just the fact that Americans don't eat well. In fact, if you compare what we actually eat to what the dietary guidelines for Americans recommend, the shortfall among the average American is huge. We're only eating about 43% of the fruit that we ought to be, 18% of the legumes, 36% of the green vegetables, 35% of the orange vegetables. Now the flip side of this, because I always try to link what's happening at the consumer end, the patient end, with what's happening at the farm end, the link here is that if Americans were eating what we recommend, we don't have the farmers to grow that food. We'd have to import it right now, because at the same time that we're neglecting policies to make sure that we eat better, we're also neglecting policies to make sure that there's American farmers growing what we want people to eat. So we'll talk a little bit more about that. So this series of crises are out there. And the reason I'm leading with those is to make the case by the end of the talk that, you know, doing something around food systems, food environments is not a luxury. It's inevitable. We're going to have to act as a society, as a health system, one way or the other. It's just a question of how deliberately we do it and whether it's proactive or reactive and whether it's early or late. The earlier we act, potentially the greater the cost savings. The later we act, the more we're going to pay. So let me dive deeper on three different ways of looking at the food system. And the first is this notion that there's this vast disconnect between what we grow and what we eat, and what we want people to eat and what we want farmers to grow. And So this was a meeting that I helped organize back in 2007 in Racine at the Wingspread Center. And one of the conclusions was that the food system we have is really unhealthy for all of us, but especially at odds with the health of children. Well, what did we mean by that? Well, first of all, what do we mean by the food system? Okay? It's not just what you buy at the grocery store. That's a piece of it. But it's everything that happens from the farm to the fork, basically, and in between. So there's what determines what farmers grow, how that gets collected and processed, how it gets distributed basically either to retailers or directly to consumers, and even food waste. Like, what do we do with that 40 or 50% of food that we throw away rather than eat? So all of this is part of the food system. And part of the reason I'm here is that over the last 10 years or so, this has become a really hot topic, and especially looking at it through a public health lens. So this is oversimplifying things a little bit. But what I want you to take home is that, by and large, the food system that we have is based on, and this shouldn't be unfamiliar to those of you in medicine, on an industrial model. And it's a model where we've focused on a particular set of inputs and outputs. And this has been a model that's come about through a variety of reasons, including technological advances, some accidents of history, but also policy. Policy has helped determine the food system that we have. And the gorilla in the room when it comes to food policy is the Farm Bill. Okay? So, by and large, the Farm Bill and farm policy over the last several decades, dating really back to the Depression, has had a primary goal of increasing production. And it was realized early on that the best way to increase production and to keep farmers on the land profitably was to focus on a few crops, namely things that stored easily, especially in the Midwest where there weren't the population centers 100 years ago that there are now, and things that grew calories quickly and easily and in ways that could be modified. And especially after World War II, this seemed like a natural fit between what farmers needed, namely a product they could sell, and what the country needed, which was more calories, or so we thought. And the reason we thought that is that about a third of the conscripts into the military during World War II were not fit for duty. They were undernourished. And the reasoning was, hey, we've got a calorie shortage, so let's figure out a way where policy can both help farmers but also increase calories. So these crops seemed like a great way to do it. Well, and that's been the rationale all the way up through today. Again, a little oversimplified, but by and large, that's true. So flash forward, there are some implications to that approach. One is that we increasingly have specialized what farms do so that now, rather than produce 9 or 10 different commodities like they did 100 years ago, our farms pretty much just produce 1, maybe 2 things. So corn and soybeans, maybe dairy, and by and large, they're specialists. And that's been a very effective model if the goal is to produce an environment, a food environment, with a lot of very readily available calories, and especially meat calories. But it's also led to a food system where those abundant calories have found some pretty novel ways of getting incorporated into food products, highly processed junk food and sodas. Not exclusively, but to a great degree. And even that's not quite accurate, because most of the calories produced by American agriculture now go towards what? Ethanol, right? It's fuel production. And then that has supplanted animal feed as the primary product. The primary product used to be animal feed, not human food, but food for animals that then become human food. So you'll notice what's missing from that equation, which is health. Really, we have a system that was never designed to address health needs. And that's still by and large true. So Adam Dranowski is a nutritional epidemiologist at the University of Washington, and he's done a lot of looking at this food system and what sort of the default system is. and how that impacts consumer choices. And so the way he summarized it, if you look at these various studies, is that the most affordable, most accessible, most inflation-resistant foods in the American food supply are also the least healthy. They're the calorie-dense, nutrient-poor, highly processed junk foods and sodas. So if that's the food supply that we want, we've done a really good job. Now, the conventional medical model has been that diet is primarily a function of individual choice. And I think until recently, that was the paradigm that we clung to in medicine and primary care. You know, that if we just do a good job of educating, that the individuals will make the right choices. Well, clearly that wasn't the case with smoking. And it's also not the case with food, because we've created a system where the logical choice, particularly if you're a person of limited income, is to eat unhealthy food, because it's the most accessible, most affordable, most inflation resistant. And so until we change the environment, it's going to be hard to argue that we're going to change the behavior of individual consumers, particularly those who most need behavior change. So one of the functions of this environment, remember, inflation resistant, not only are on a per calorie basis junk foods and sodas inexpensive, but they've gotten increasingly so over time. And so just taking USDA data and mapping it against consumer price index and how it's changed over time, you get a graphic like this, where, you know, fruits and vegetables have actually increased in real terms relative to sodas and sugars and sweets and fats and oils. And when we talk about fats and oils, what are those? 80% of them are soy oils, which are now in salad dressings and cooking fryers in fast food restaurants and other processed products. And the sweets, I have slides on this, but I didn't include them, are overwhelmingly fructose, high fructose corn syrup. So it's from corn. Second way of looking at this food system is through antibiotics, which obviously I focused on because of the audience here. We all have an investment in antibiotics working, right? It's one of our greatest tools in human medicine. But this industrial model, which takes inputs to create outputs, which focuses on production, one of the inputs that it relies upon is antibiotics, which have been used intensively for decades in meat production, and in fact are pretty integral now to an industrial meat model. And then it's not just antibiotics, it's all sorts of input chemicals that we're going to talk a little bit more about, hormones, pesticides and other petrochemicals, as well as some other things. So remember, inputs, outputs. So in terms of antibiotics, what are we talking about? According to data collected by the FDA from pharmaceutical companies, 29 million pounds a year of antimicrobials are sold for use in animals, okay? 29 million pounds a year. On the human side, 7 million pounds. So percentage-wise, by volume, 80% of all the antimicrobials sold in the U.S. are sold for use in animals, okay? 80%. Now you might think, and you hear a lot from folks who are in the animal pharmaceutical industry, that this is a little unfair because, you know, very few of those are human antibiotics. But in fact, that's not true. About 60% are what we call medically important classes. So things people recognize: penicillins, tetracyclines, macrolides, streptogramins, sulfadrugs. And here's the numbers. And you see that there's some other things in there too, like cephalosporins. Okay? Until recently, most of the chickens that are grown for human consumption came from eggs that were injected with cephalosporins, including organic, by the way. But when the FDA communicates this information back to the public, sometimes they bury some of the detail in this not independently reported class, which contains things like the quinolones and streptogramins. So what are some things to notice here? One thing to notice is there are classes that are not particularly important to humans, we think, like the ionophores, but they're outweighed by things like tetracyclines. So very prevalent in poultry production in the US still. Penicillins and others. So how are antibiotics used in animals? Well, yes, when an animal's sick, you would want to treat them, right? Just like if a human's sick, you want to treat the human. And so one of the ways in which antibiotics are used on the farm, FDA approved, is through things like injection into a cow. You know, cows are expensive. As well as what's termed off-label use. So these are not approved, but they're legal uses, like injecting things into eggs. That's an off-label use that is legal but not approved. And so FDA got rid of cephalosporins injected into eggs, but they still use gentamicin injected into eggs, which is a problem. But the other use of antibiotics is in animal feed. And most of these, if not all of them, are what I and people I work with call non-therapeutic uses. They're not prescription. You can go to Menards or Fleet Farm and buy 20-kilogram bags of auramycin or another tetracycline product and just go out and apply it in your production system. And the label that FDA approves is for uses like growth promotion, feed efficiency, and then this rather vague term, disease prevention and control. But again, there's no veterinarian involved currently, no one making a diagnosis of disease. So in fact, most of the chickens and the hogs in the country now are getting antibiotics in feed for most of their lives. And if you look at that FDA collected data and you concentrate on this 9 million pounds a year, it turns out that 90% of it is for addition to animal feed or water. So these are kind of the perfect storm. These are antibiotics added at lower than therapeutic doses without a prescription for most of the life of the animal. So the selection pressure, the potential selection pressure under those conditions is enormous. And as I said, this is what's prevalent in U.S. agriculture, okay? So the heightened concerns are these perfect storm conditions. Not only is there no prescription, but because the veterinarian's not been involved, there's no oversight by a medical professional. You can't really control the dose, can you? If it's in the animal feed, you don't know how much of the feed that particular animal's eating. And because the animals are kind of packed in, there's very poor infection control. So even though we wouldn't want to have a nursery with the babies packed cheek by jowl, and yet that's exactly the way in which we raise the animals. And then there's no ecological control. So we know that when you put antibiotics in feed, 3/4 of it will go through the animal into the manure, but then legally the manure is spread back on the fields. Okay? Yeah, or in places like North Carolina, it's sprayed with a sprinkler system, and those sprinklers are running virtually nonstop. So downwind of some of these facilities, there has been air sampling, and you can find resistant bacteria in the air particles downwind of these sprayers. So I guess the good news is that there's substantial variation between countries. And even when countries like Denmark, for example, have a system where they're raising a lot of animals, because Denmark's the largest pork exporter in the world. They have a lot of hogs, as many as Iowa, for example, about 30 million head a year. So even in a country like that, they only use about a sixth of the antibiotics per kilogram of meat produced than the Netherlands did. Where's the U.S.? There's the U.S. The U.S., on a milligram per kilogram basis, uses about six-fold more antibiotics than a country like Denmark does. So this is just a difference in policy. It's not that you have to use. Obviously, the Danish pork producers are profitable. They've got a good market, but their policies don't allow them to use these feed antibiotics legally. And now the rest of the European Union doesn't either. So it's interesting. The Netherlands looks pretty high, right? But they were looking at this data 3 years ago, and they made a very concerted effort to reduce antibiotic use. And in 2 years, they reduced it by 50%. Their new goal is to reduce it by 70%. So this infographic's from the CDC, and what you should take away from it is that the new medical understanding of antibiotic resistance is that it's an ecological phenomena. It's an environmental health problem. Because the environment we're talking about is not our environment. It's the microbial environment of which we're a part. So our gut flora share the same environment with the gut flora of the animals on the farm. And we can document and have documented the passage of bacteria from one environment to the other. And are sewage treatment plants part of that? Yes. Are potentially antimicrobial soaps a part of that environment? Yes. It's one big microbial environment. Now, in terms of the animal side, the Centers Disease Control has looked at the science and found that it's very compelling that the animal use that I've been laying out is directly linked to resistance in humans. Okay? So we shouldn't, and this is an oversimplified version of how this works. So you've got a community of bugs out there, right? Some of them are naturally resistant. And then into that environment, you put these antibiotics. And it doesn't matter whether we're talking about the farm or the hospital. It's kind of the same thing, right? And if the levels are high enough, you kill off the susceptible bugs, leaving these resistant ones, which then outcompete and propagate and spread. So what drives resistance is really two things. Having those naturally occurring resistance genes, but then the selection pressure from the antibiotics. So how does that work in the farm? Well, like I said, it's kind of the same thing. You've got these resistant bugs, and then they out-reproduce and are propagated on meat, in air, in water, and soil. Okay? So let's just look at the meat supply. There have been various studies by the FDA as well as by groups like Consumer Reports periodically testing meat. And the not so great news is that a substantial part of our meat supply now carries multi-drug resistant bacteria. And typically that's things like Enterococcus, but it can also be E. coli, even staph and MRSA. The MRSA is still occasional. It's not common, but you do find MRSA on meat. And so, for example, if you go out and buy a chicken breast, 99 times out of 100 there's going to be a resistant bacteria on that chicken breast. And more often than we'd care to admit, it's multi-drug resistant. Now, it tends to be lower if it's organic chicken, often still not zero, but lower, which you would expect. And so we're beginning to see when we have these periodic foodborne outbreaks that now the CDC has started to report the bugs being the drug resistance of the bugs. So this is the most recent one that I mentioned, Salmonella Heidelberg, multi-drug resistant. Turns out it was from Foster Farms chicken. And there's a case in Wisconsin. Foster Farms is a California chicken label, so that's where most of the cases are. So there are some new, rather alarming developments. Salmonella, kind of classic foodborne bug, right? So you're not too surprised, I guess, that drug-resistant bacteria are going from the farm through the animals to the meat supply. But there are some other things that you wouldn't normally think of as being foodborne bugs, which are in fact being found on the farm and communicated through the food supply. So one I mentioned is livestock-associated MRSA. So this can be various strains, but mostly it's a strain called CC398. And this is just one study by Lance Price, a colleague at George Washington University. And he's been able to document how MRSA travels from the human population to the farm and back again. So it kind of looks like this. Some of us are colonized with staph, right? And these can be susceptible or resistant. So it looks like some of these CC398 strains were once susceptible, traveled to the farm environment, and then we have these perfect storm conditions exposing these susceptible bugs to antibiotics kind of on a routine basis. It's an environment where they're very likely to pick up resistance determinants, and then through the meat supply or other ways, they can travel back to the human population. This is still an evolving story, but this is the scenario that seems to be playing out with MRSA. Is this why we now have more community-acquired MRSA? I don't think we could say that yet. We could say it for sure in the Netherlands, where 1 in 3 hospital MRSA cases are directly linked to the farm. In fact, you go into the hospital in the Netherlands, they do an entrance query, they do a little history. If you're a farmer, you are presumptively thought to have MRSA that's farm-associated until proven otherwise by culture. We don't have that in the US yet, but it's not to say that we won't at some point. Another interesting case is these XPEC E. coli strains. So these are E. coli that are resistant to extended spectrum antibiotics. And Jim Johnson at the VA Medical Center in Minneapolis and colleagues have been looking at this for a number of years, and including one study that compared E. coli that are susceptible and multi-drug resistant in human isolates and animal isolates. And what they found is that there was particular strains that they found in the chicken farms. And both the susceptible strains and the resistant strains looked pretty similar. They looked like a farm-associated strain. When you go over to the human isolates, the resistant strains looked more like the farm strain than they did like the susceptible human isolates. So it seemed like a piece in the puzzle that these resistant bugs were connected to the farm. And if you look at the subsequent research that Jim's been doing, this story seems to be gaining credibility, that the farm, and particularly the retail chicken supply, seems to be the source for a lot of the multi-drug resistant XPEC E. coli that are then causing problems in the human population. So would this be a reportable foodborne disease? No. Doesn't mean it's not coming through the food supply. So, I could go on because I've been working on this issue probably too long. And people often say, well, where's the study showing this link between farm antibiotics and human problems? There's not just one study. There's literally hundreds. So in the back of the room, I've got this annotated bibliography. You can look at that more. Oh. So let's go on to the third thing. The third lens about the food supply and links to the human condition. And the next speaker, Maria Valenti, is going to talk a little bit more about this. But let me just touch on food pollutants. The notion that our food supply is a vehicle for chemical exposure in the human population. So I want to just make a link to something you probably recognize. How many know the story of DES, diethylstilbestrol? Yeah, I thought you would. What most people don't know, this was taken out of human use at the end of the 1970s when it was use in pregnancy, presumably to prevent miscarriages, which it didn't do, ended up being linked to reproductive tract cancers, right? What most people didn't know, though, is that DES had a long history of use as a growth promoter in meat production. And in fact, even after it was withdrawn from the human market, it continued to be marketed for animal use. Okay? Continued to be marketed for animal use in cattle through '79. Once DES was taken off the market, it was replaced by 6 other steroid hormones that are still in use today. This is out of sight, out of mind. Nobody tracks this use. We have no data on how prevalent. We think it's very prevalent. I mean, it's an accepted part of cattle production, but nobody's looking at the impacts on people eating the cattle, or very few. And yet the residues of these steroid hormones in meat are widely acknowledged. Another example. Until very recently, most of the chicken produced conventionally in the U.S. Was produced using arsenic compounds. This has been legal since the 40s. And the reason that FDA approved this was for purposes like growth promotion, meat pigmentation. And this continued until I actually did the first study where I went out to restaurants and supermarkets and bought meat and sent it off to a lab and had it tested for total arsenic. And what I was able to show is that a conventionally raised chicken was more likely to have arsenic residues in it that I could detect even with my relatively crude, under-financed project. But then FDA did its own testing and they confirmed that finding. Well, subsequently, we petitioned the FDA in the late 2000s to end the practice. Didn't hear back from them. Then we threatened to sue. And finally, this fall, the FDA announced that the makers of 101 different arsenic products, the makers of 98 of them were taking them off the market. It's a huge win. I mean, this is just me, basically, and a few other allies calling for this. And it created real change. If you want to see more about that story, there's a blog on our website called Arsenic, It's What's for Dinner. It's interesting that the FDA action took 3 of the 4 arsenicals off the market, but they left the 4th one on the market. Not sure why. So if a chicken producer is intent on using an arsenical, they may just be able to switch products and use this one that's still in the market. What other hormones are we adding to the food supply? Pesticides. I mean, you might not think of them as hormones, but in fact, dozens are on the list of known or suspected endocrine disruptors. Dozens. They include some really common names. Atrazine, we heard Monica, I think, talk about atrazine. But there are others. Lindane, of course. I hope none of you is still seeing Lindane used by parents, but it's still legal. The organophosphates, some of the fungicides. So what we're seeing is, at least in these rural areas, a picture where it is possible, if not likely, that certainly people living in those areas, producing their livelihood in those areas, are exposed to multiple hormone-disrupting chemicals. And just to show how ubiquitous this is, this is a graphic, and I'm sorry I don't have the source up there, but I can get it for you, just showing that the average conventionally raised produce product has not one pesticide residue, but multiple pesticide residues. And organically produced products are significantly better in terms of that profile. But among the conventionally raised, it's the majority. Another kind of additive, though, and this just goes to the point that we're talking about a mixture of different chemicals, is food dyes. And these are deliberately added to the food supply and have also been linked not to hormonal effects, but to behavioral problems. So when we're talking about the food system, for most consumers, we're really talking about what amounts to a toxic soup, at least potentially. And this is both things that are intentionally added to the food, but also that contaminate the food because they're used upstream on the farm. So pesticides, heavy metals, dioxins, PCBs, brominated flame retardants, perchlorate. The ones in the green are the ones that we, through policy, allow or even promote the use of, whether it's insecticides, bisphenol A in food packaging, phthalates, perfluorocarbons. And a few years ago, if you haven't seen it, I recommend this scientific statement from the Endocrine Society. This was the first statement they ever did. And they made the case, a couple of cases. One was they really called attention to the fact that exposure to endocrine disrupting chemicals is routine, that we're all exposed, basically, and that the animal science and the human science suggests very strongly that there are ongoing impacts across not just one endpoint, but multiple endpoints. And I see I'm running a little low on time. So let me just give you one example, and I could go on and on, right? So I'm using this with permission from Tyrone Hayes, the leading toxicologist researcher of atrazine. So he had grant money from Syngenta, the manufacturer of atrazine, to study the chemical. And then when he came out with his results, they weren't very happy with him. This is what he found. Up here in this range, and this is a logarithmic scale in parts per billion, you see the recommended labeled application rate of atrazine up at the top of the scale. These are where it's found in water supplies in Midwest streams, even in the rain. After atrazine's applied, when it rains, you can find it in the rain. Down to the 1 part per billion level. Frogs exposed to 1/10 of that amount, 0.1 parts per billion, will produce offspring that are hermaphrodites. So what does that look like? This is what it looks like. Genitalia in one frog that have both ovaries and testes. And when Tyrone says that when he first presented this information, he was told by Syngenta that this was a variant of normal. And so he took to putting this on his slides. It's not normal to have testes and ovaries in the same individual, okay? This is just to say there aren't just human impacts. There are important ecosystem impacts. We're in the land of fishing. What is the impact not only on frogs, but of fish downstream of these agricultural areas? Well, we know one impact, very visible, is this dead zone in the Gulf of Mexico. It varies year by year, but it's huge. It's thousands of square miles of basically hypoxic, dead ocean floor. And it's traceable to this economic model of production agriculture, producing a lot of something without really any regard for the health to the ecosystem or to the health of the human population. Not to mention, I'm not going to go into climate change because Bob Gould's going to talk about that later, but you know, many of these are petrochemicals. So they have all these effects, but they're also a carbon-intensive food system. So let's talk, how many minutes? 3? 4. Let's talk about where do we go with all this information? We're going to delve into this a lot more tomorrow, but I want to just leave you with this. In our medical settings, one of the things we have to do is to start challenging conventional wisdom and also sort of the thinking that goes along with it, both institutionally and individually. So individually, I would bet many of you already do this. You shop with your wallet. And we're lucky in Wisconsin that we've got organic valley producers who aren't using antibiotics and many of these other practices. Retail operations like Chipotle or Applegate are supporting a lot of these farmers, and it's a huge and growing market segment. But is this market change going to change the whole country? Maybe eventually, but do we have the luxury of waiting for the market to affect that change? I would argue no. We're losing our antibiotics quicker than the market's moving. So these producers are doing the right thing, and they're a proof of concept. You can be profitable, produce good quality product without hormones, without antibiotics, make a living, and be in a vibrant rural community. But still, they're the exception rather than the rule. Food dyes. Recently, we've been hearing Kraft has taken food dyes out of mac and cheese. It's taken food dyes out of cheese slices. There's petitions with hundreds of thousands of signatures asking M&Ms to take food dyes out of M&Ms so that the M&M you buy in the US would be the same as the M&M you buy in Europe. Now they're not the case. One has food dyes, one doesn't. Guess which one? I would challenge us, too, to change the thinking that we do. So often in our environments, we talk about the evidence base. So we've created this really complex environment. You're going to hear more about it from Maria, and a food system that's chemically laden. Where was the evidence that that would be healthy? Where was the evidence that it was healthy to design a food system that depended on routine antibiotic use? Of course, there wasn't any, right? It's only now that we're trying to take a step away from some of those practices that we're being asked to show the evidence that not using antibiotics will be safe for animals, or that not using food dyes won't lead to some other change in the food system that somehow impacts children adversely. And so finally, the challenge, finally the challenge is, what is our role as health professionals as policy advocates? It's a big, complex system out there. And systems, we know, resist change. They've got a lot of inertia, whether we're talking about the climate system, right, John? Or whether we're talking about the microbial ecosystem or the agricultural system. A lot of inertia. And case in point, the Farm Bill, okay? Farm Bill, hugely important, a lot of forces of inertia. And so, we heard maybe some of you that this Farm Bill was very different because it got rid of a lot of the direct subsidies to farmers to produce corn and soy and cotton, which is true. However, it added many subsidies to the insurance industry to insure people producing corn and soy and cotton. So it's basically, taking away one, giving another. And that's not in and of itself a bad thing, but the Farm Bill didn't address problems like U.S. farmers lacking an incentive to produce fruits and vegetables, okay? Or at least it did very little. And let me just skip through this because I'm going to talk about it tomorrow. But I want to leave you with two things. One, we can make a difference. You saw this this week. Was it this week? Yeah, very encouraging. We can't say for sure that Michelle Obama doing the Let's Move initiative or all the other great work by many of you to change community food environments has resulted in this drop. But boy, it sure seems like something happened and we were all working pretty hard on it. So, maybe we got to pat ourselves in the back. And the other thought I'd leave you with is that, like I said, systems resist change. And this is one of my favorites from my own paper. The CEO of Philip Morris in 1998, still saying, I'm unclear whether cigarettes cause smoking-related disease. No matter how much science we marshal, it's always going to be contentious because there are very well-funded entities who are invested in the status quo. And we can't pretend that that's not the case. So thank you, and I look forward to some questions. Hey, Bob.
Thanks, Pat. Okay, thanks for the great talk. I'm Bob Gould from Physicians for Social Responsibility. Your last slide is also very reminded of the very well-funded and intensive tobacco company. The people who used to work for the tobacco company right now are very powerful, like in my state of California, of opposing any of the initiatives for to get rid of sugary sweet beverages, and that particular contribution to obesity and diabetes. And I just was interested in if you have any comments about that. Thanks.
Yeah, there's actually the tobacco archives were put online by people like Stan Glantz and Lisa Barrow at UCSF. And folks have gone in and mined that incredible archive and found that the playbook that we know was employed by the tobacco industry is the same playbook that's being employed by pesticide industry, by fossil fuel companies around climate change. It's like no great secret, but it's many of the same folks. And so, for example, in the 1960s, the tobacco industry created a front group called the Advancement of Sound Science Coalition. And the sole intent of that was to seed doubt about the science around tobacco impacts. But, the term sound science, maybe less so now, but when I started in this work 20 years ago, was a very highly used term around climate science, to debunk legitimate science and basically claim that it wasn't sound, because, surely we can't be changing the climate, or around other environmental health science. So I think, and Tyrone Hayes, too, has been struggling. Harper's just did a big piece, I believe. New Yorker, just this week. Last week, did a big piece on Tyrone Hayes. He's getting hammered. Very credible Harvard-trained scientist, but he's also an outspoken advocate. Like, he's talking about what his research means. And, he's getting incredible pressure. We're not doing a good job in public health or environmental health defending the work of scientists who are brave enough to speak out about their conclusions. Anybody else? Well, I look forward to talking with more of you. I'll be around all weekend, so come up and chat me up and ask your questions then. Thank you.